Hello everyone. I welcome you all for Prof Buster Live Progenitor batch. The highlight of this batch is integration. So today we are going to continue antimicrobial drugs in pharmacology in integration. So let me share my screen with you. I guess you can see the screen. And here, let's continue. So in this batch, the Prof Buster Live Progenitor batch, we are going to continue the antimicrobial drugs in pharmacology. Now in microbiology, I taught you fungus. I taught you all the fungal disorders, fungal disease in microbiology and all systems we have completed. Now it's time to see the drugs for the fungus, that is antifungal drugs. So in this session we are going to discuss antifungal drugs and you can integrate it well with the microbiology. Okay, so let's start it. So here this session is pharmacology session in which we are going to discuss antifungal drugs in the antimicrobial drugs. So in pharmacology, we are going to continue with antifungal drugs. You can see these all chapters are in your syllabus in the antimicrobial drugs in pharmacology. Among all these units, these all, the which are highlighted in yellow, they are already completed. And in this particular session, we are going to continue with antifungal drugs. So let's start with antifungal drugs quickly. But I cannot teach you antifungal drugs. No, I cannot. Unless and until you don't understand the classification of the fungus. Those who have attended my microbiology classes, they already know the classification of the funguses very well. But here we will revise it quickly. So first in the 5 minutes, we will quickly revise the classification of the fungus and after that we will see the antifungal drugs. So here you can see the classification of the fungus. We are dividing fungus in 4 categories. Here you can appreciate the 4 categories. What are the 4 categories? The first category is yeast, in which the fungus is spherical in shape and it divides by budding. Appreciate, it is dividing by budding. Learn 2 things. It is spherical in shape and it is dividing by budding. Number 2, molds. See molds. Here the fungus is elongated in shape. You can appreciate the fungus is elongated in shape and it is dividing by branching. The branches are known as hyphae. So here the fungus is spherical and divide by budding. And here the fungus is elongated. It's not spherical. It's elongated and it divides by hyphae formation. That is branching. Now there is a third category that is yeast-like. Why it is known as yeast-like? Actually it is yeast but look like the mold. That's why it is known as yeast-like. So since it is yeast, it is spherical in shape. Okay, but it keep on dividing by budding, So it is looking elongated like the mold, but actually it's not mold. It's yeast only, but it is looking like the mold. Okay, and this is known as pseudo hyphae because it is having the constrictions in between. It is not a true hyphae. The true hyphae is parallel. You can see in the true hyphae, you can see it's parallel. There are no constriction, but here you can appreciate the constrictions are there. Appreciate the constriction. So it is a pseudo hyphae. It's not a true hyphae. And the last category is dimorphic fungus. What do you mean by dimorphic? Dimorphic means double roll. At 37 degree, they are yeast. They are spherical. They divide by budding. And at 25 degree, they are mold. They are elongated and they divide by hyphae formation. So human body temperature is 37. So inside human body, they are yeast. And outside the human body, in the environment, they are mold. I guess everyone knows this classification. I will show you some videos to understand it well. You can see these are yeast. All 4 I will show you in the form of the videos. First, I'm showing you a video of a yeast. Appreciate they all are spherical and appreciate they are dividing by budding. They are dividing by budding. Okay, so yeast I have shown you. Now I'm showing you the molds. Appreciate these are molds. Appreciate they are elongated and appreciate they are dividing by hyphae. Appreciate the hyphae formation, the branching, the hyphae. That is mold. So we have seen yeast, we have seen mold, and now I am showing you yeast-like, which is actually yeast but look like mold and it is having the pseudo-hyphae. See this video, a small video. You can see they all are elongated. You may feel it's mold. No, it's not mold. If you see closely, you can appreciate the constrictions in between. These all have the constrictions in between. So these are not hyphae. Actually, these all are pseudo-hyphae. Appreciate the constrictions in between. So it is yeast-like. And the last one is dimorphic fungus. Dimorphic fungus at 37 degree, they are yeast. They are spherical. They divide by budding. And at 25 degree, they are mold. They divide by branching. You can see. That is dimorphic fungus. Appreciate the dimorphic fungus. So we have seen the classification well. This is the first classification of the fungus. Okay, that is known as morphological classification. I guess everyone knows the examples under each category. But I am interested in the second classification of the fungus. There are two types of classification in the fungus. The first is the morphological classification, which is this one. And second is pathological classification, which is in front of you. So see this classification also. After that, I am starting the antifungal drugs. So you can see this is the second classification of the fungus, which is based on the pathogenesis. That is the diseases caused by the fungus. In human body, fungus causes 4 types of diseases. What are the 4 types of diseases? Number 1, superficial mycosis. It's superficial. Okay, superficial means involving the keratin layer of the skin, nail and hair. So it involves the dead layer, keratin layer, superficially, only superficially. You don't go inside. That is superficial mycosis. The second is subcutaneous mycosis, just below the skin. Below the skin, we have the subcutaneous layer. So these one causes granulomas in the subcutaneous tissue. That is subcutaneous mycosis. The third is systemic mycosis. These are the fungus which enter via respiratory route. First, they go in the lung, involve the lung, causes pneumonia. From the lung, they go in the blood and involve multiple organs. Since they involve multiple organs, it is known as systemic mycosis, also known as deep mycosis. Systemic and deep mycosis is same. And last one is opportunistic mycosis. These are also systemic. They also involve multiple systems. They are also systemic, but they need an opportunity to enter the human body. What is opportunity? That's why they are known as opportunistic fungus. What is the opportunity they need? The opportunity is low immunity. Whenever the immunity is low, then only they can enter the human body. Otherwise, they cannot enter the human body. Maybe the person is having AIDS. Maybe the person is having on steroid therapy, chemotherapy, HIV. So these are the 4 main fungal disorders. The 5th one is mycotoxicosis. The mycotoxicosis, in which fungus do not cause the disease. The toxin secreted by the fungus cause disease in human. So you can see the 5 types of disorders caused by the fungus in human body. You can see superficial mycosis, subcutaneous mycosis, systemic or deep mycosis, opportunistic mycosis, mycotoxicosis. So in superficial mycosis, there are 4 fungus. In subcutaneous also, there are 4 fungus. In systemic also, there are 4 fungus. In opportunistic, there are 6 fungal disorders. And mycotoxicosis is not important. So if you add them, total 18 fungus in your syllabus. So you should know their names. Okay, these are the name of the diseases which are caused by fungus. These are the fungus. These all are fungus. You can see Cryptococcus, Candida, Dermatophytes, Aspergillus. And these are the diseases caused by these fungus. So we are dividing the diseases into 4 categories: superficial mycosis, subcutaneous mycosis, systemic or deep mycosis, opportunistic mycosis, and mycotoxicosis is not important. Opportunistic is also systemic. I mean, here also multiple systems are involved. Here also multiple systems are involved. But these can enter a healthy individual. These will enter only in immunocompromised individual. Okay, they need opportunity. They involve the subcutaneous, they involve the superficial layer. They involve the superficial keratin layer of the skin, hair and nail. And these one involve the subcutaneous layer below the skin. So these are the 4 fungal disorders. You can learn their names. So in the superficial, what are the 4 funguses in the superficial? Tinea versicolor, Tinea nigra, Pedra and Dermatophytes. Dermatophytes is ringworm. I guess everyone knows this classification. If you don't know, please learn it before we start the antifungal drugs. Subcutaneous mycosis are also 4. Mycetoma, Sporotrichosis, Chromoblastomycosis and Rhinosporidiosis. These are 4 in number. Systemic is also 4. Histoplasma, Blastomycosis, Coccidiomycosis, Paracoccidiomycosis. And opportunistic are 6 in number. Candidiasis, Zygomycosis, Aspergillosis, Nemocystis, Panicillosis, Cryptococcus. So please learn them. Now I will tell you the various antifungal drugs. In various antifungal drugs, I will tell you which drug is drug of choice in which condition. So that's why you should know this classification well. And in this classification only, we will keep on marking the drug of choice of each disorder. Okay, so let's start it. Let's start the antifungal drugs. This portion was from microbiology till now, and let's integrate the microbiology with the pharmacology. So here you can see the classification of the antifungal drugs. Okay, so let's start antifungal drugs. Can I start? Chalo, let's start it quickly. We divide antifungal drugs into 5 categories based on their nature. Okay, the first is antibiotic. Antibiotic have 3 categories. We are having polyenes. I will teach you well. We are having echinocandins. We are having heterocyclic benzofuran. So there are 3 categories in the antibiotics. I will teach you all 3 in detail. The second is antimetabolite, which don't have any further category, antimetabolite. It is having only 1 drug. The third category is azoles. Azoles are of 2 types. Imidazole Triazole. Imidazole Triazole. The fourth category is Allylamines. Allylamines. And the fifth one are the topical that we don't have to see in detail. So you can see these are the four categories we have to study in detail. Drugs under each category, I will tell you one by one when I will teach you the categories in detail. Okay, so if you want to learn this classification, you should learn that. Learn the four categories. Antibiotic, antimetabolite, azole, allylamine. All are four. Antibiotic. Okay, there are four types of antifungal. Antibiotic, okay, antimetabolite, antibiotic, anti-metabolite, okay, azoles and allylamines. You should learn it. Antibiotic are of three types. Okay, you should learn the three types of antibiotic. Polyenes, Echinocandins, and the third one is heterocyclic benzofuran. So you should learn this classification. If you can't learn this, you can learn the second classification. There are two classifications of antifungal drugs. The first is based on their chemical nature. You can see based on the chemical nature, they are antibiotic, antimetabolite, azoles, and allylamines. All of them are starting with A. These are the four categories. Okay, or else you can learn the second classification, which is more easier to understand based on their mechanism of action, how they kill a fungus. Imagine this is a fungus. I want to kill it. Okay, this fungus is present in my patient's body. I am a doctor. I want to save my patient. So to save my patient, to cure my patient, I want to kill this fungus. There are four ways I can kill this fungus. First, you understand the diagram of this fungus. You can see this is the nucleus. Okay, and this is the nucleic acid. This is the nucleic acid DNA. And this is the nucleus. You can see this is yellow color is cytoplasm. This is cell membrane. And this is cell wall. Cell wall. Fungus also have cell wall like the bacteria, but the structure is different. Bacterial cell wall contain peptidoglycan. Fungus cell wall don't contain peptidoglycan. It contain chitin and beta-1,3-glucan. Okay, the structure is different, but it is having the cell wall. So you can appreciate the cell membrane. You can appreciate the cell wall. Where is cell wall? Where is cell membrane? You can appreciate in this diagram, this is nucleus. This is cell membrane. And this is cell wall. If you understood the diagram, now I want to kill this fungus. There are four ways, and that decides the four types of antifungal drugs. What are the four ways? Number one, I can give the drugs that will cause the pores in the cell membrane. The drug which will cause the pores in cell membrane so that all the cytoplasm will leak out and the fungus get killed. So the first way, alter cell membrane permeability. That is causing pores in the cell membrane. They will alter the membrane, cell membrane. They act on the cell membrane. So polyenes, azoles, and allylamines act in this way. Polyenes, azoles, and allylamines act in this way. There is second category that inhibits cell wall synthesis. Let me show you the second category that inhibits cell wall synthesis. Okay, you can see this is the cell wall. Can you appreciate the cell wall? This one is cell wall. So there are certain drugs, okay, which inhibit cell wall synthesis. They act on the cell wall and they inhibit cell wall synthesis. So they act on cell wall. So Caspofungin is the drug that is causing so. Okay, now coming on the third category drug that act on the nucleus and inhibit the mitosis. That disrupt the mitosis of the DNA, the mitosis. Okay, so the drug is Caspofungin, which is doing so. Okay, Caspofungin is doing so. And the fourth category, there are drugs that inhibit nucleic acid synthesis. They are also acting on the nucleus, but they don't interfere with mitosis. They inhibit nucleic acid synthesis. And here the drug is 5-HC, I mean fluorocytosine. Fluorocytosine is the drug here. Okay, so we are dividing the antifungals into four categories. What are the four categories? I want to kill a fungus. I want to kill a fungus. What are the four ways I can kill a fungus? You tell me what are the four ways. I can give the drug that alters cell membrane permeability. Cell membrane permeability so that there will be pores in the cell membrane and the cytoplasm will leak out. There are drugs that inhibit cell wall synthesis. So these drugs act on cell membrane. These drugs act on cell wall. There are drugs which act on nucleus and interfere with mitosis. There are drugs which act on nucleus and inhibit nucleic acid synthesis. Both of them act on nucleus. These also act on nucleus. These also act on nucleus. But they are interfering with mitosis. They inhibit nucleic acid synthesis. Now learn the name of the antifungal drug in each category. Okay. So the one which inhibit nucleic acid synthesis is fluorocytosine. The one which interfere with mitosis is Caspofungin. Okay. The one which inhibits cell wall synthesis. The one which inhibit cell wall synthesis, you can see, is Caspofungin. And the remaining are polyenes, azoles, and allylamines. they come in cell membrane category. So we can mark it here. We can mark it. So can you mark the drugs which alter cell membrane permeability? You can see polyenes, azoles, and allylamines. So let me highlight. Let me highlight polyenes. Okay, azoles, all azoles, imidazole as well as triazole. Okay, and allylamines. So the red one are altering cell membrane permeability. The second, I am showing you the one which inhibits cell wall synthesis. That is Caspofungin. Where is Caspofungin? These one. So they alter cell wall synthesis. They act on the cell wall. The third one I am marking with purple color, that interfere with mitosis. That is Grisofulvin. Where is Grisofulvin? You can see it is a heterocyclic benzofuran. So this one inhibit the mitosis or interfere with the mitosis. And the last one you can see, the one which inhibit nucleic acid synthesis. Okay, that is fluorocytosin. You can see where is fluorocytosin? This one. The one which is inhibiting the nucleic acid synthesis. So appreciate the mechanism. So based on mechanism of action, you can learn like that. Either you learn this classification based on their chemical structure, or you learn the classification based on their mechanism of action. However you learn, but you have to learn this classification. So say the 4 mechanism of action of antifungal drugs. So the one which act on the cell membrane is polyene and azoles and allylamines. You can see the red one. They cause pores in the cell membrane so that the cytoplasm leak out. You can see the blue one, the second one. They act on the cell wall. Echinocandins act on the cell wall and they inhibit cell wall synthesis. I will tell you the exact step. Okay, the third one you can see Grisofulvin, that inhibit mitosis, interfere with mitosis. And the last one you can see antimetabolite, fluorocytosin. They inhibit nucleic acid synthesis. So please learn the 4 mechanism of action and based on which we have learned the classification. The same diagram you can see. Can you see this is a fungus? This is the same diagram I have drawn. I have drawn the fungus like this. In the books, it's given like this. You can see this is a fungus. In this fungus, you all can appreciate the nucleus which contain DNA, RNA. You can see this is cell membrane and this is cell wall. You can appreciate, if I'm zooming this section, you can see this is cell membrane. You can see cell membrane and you can see the cell wall. The cell wall of the fungus is made up of 2 things. Okay, chitin and beta-glucan, 1,3-beta-glucan. So you can see the cell wall. Okay, the same diagram you can see. Now let's start it. I will teach you all antifungal drugs in 2 master charts. In just 2 pages, 2 master chart. We will complete entire antifungal drugs. Yes. You can see here. We will start with antibiotic. First of all, I will teach you antibiotic. I will teach you the 3 type of antibiotic: polyenes, echinocandins, and heterocyclic benzofuran. So I will teach you polyene, echinocandins, and heterocyclic benzofuran. Okay, under a fixed set of heading. After that, I will come on antimetabolite. You can see I will come on the antimetabolite. I will teach you antimetabolite. After that, I will come on azoles, imidazole, triazole. I will teach you both the azole. Imidazole, triazole, and finally I will come on allylamine. I will teach you all these drugs under a fixed set of heading. You know my standard heading. First of all, I will let you know the introduction of each of them. Enumerate the drugs in each category. Mechanism of action. You already know the broad mechanism of action. The exact step I will let you know. Pharmacokinetics, interaction wherever required, adverse effect, and uses. Uses, they all are antifungal drug. They will be useful in fungal disorder. But which fungal disorder? Are they useful in superficial mycoses, subcutaneous mycoses, systemic mycoses, or opportunistic mycoses? You know the classification well. And here we can write it down. Okay, I hope you got it. So you know my 4 category, the 4A. I will teach you all 4A. I will teach you antibiotic. I will teach you antimetabolite. I will teach you azole. And I will teach you allylamine. Okay. Got it? So let's start it. Let's start all these. So total, if you count, we are having 6 drugs to discuss. 6 or 7 drugs. Quickly, we will do that. So let's start it. Let's start with the antibiotics. I'm starting with antibiotics. You know my way of teaching. In the antibiotic, I'm starting with the first category, polyenes. Why polyenes are known as polyenes? In the introduction, you tell me why polyene. Have you read chemistry in your school time? What is ene? What is ene? What do you mean by ene? Suffix in the chemistry, it's double bond. Double bond is known as, it is having multiple double bonds. That's why it is known as polyene. Can you see double bonds are there? Multiple double bonds. You can see the structure. How many double bonds you can see? Here you can see a double bond. Here you can see a double bond. Many double bonds are there. Appreciate, many double bonds. Here also I can see a double bond. Because it is having many double bond, it is known as poly. Poly यानी multiple, ene यानी double bond. That's why it is polyene. So in the introduction, you should write the meaning of the name. Why it is known as poly, why it is known as ene? Because it is having multiple double bonds. You should write this, not triple bond. It is having multiple double bonds. Okay, the prototype drug here is Amphotericin B. Enumerate the drugs. There are 3 drugs. What are the 3 drugs? The 3 drugs is Amphotericin B, Nystatin and Hamycin. But the prototype among them is Amphotericin B. Amphotericin B is prototype, but you should learn the 3 drugs. What are the 3 drugs? Amphotericin B, Nystatin and Hamycin. So write down the introduction, write down the drugs. Now come on, mechanism of action. Mechanism of action. You tell me where it is coming. All polyenes, what does they do? They alter the permeability of the cell membrane. They cause pores in the cell membrane so that cytoplasm will leak out. So let me tell you the exact mechanism of action. So since Amphotericin B is the prototype, we will see Amphotericin B in detail. Okay, Amphotericin B is obtained from a fungus. Okay, it is obtained from a fungus. The name of the organism is Streptomyces nodosus. Streptomyces nodosus is the name of the organism from which it is obtained. That's the introduction if you want to learn. Mechanism of action. All polyenes, what does they do? They go in the cell membrane of the fungus. After going in the cell membrane of the fungus, the cell membrane is made up of ergosterol. Human membrane have cholesterol. Fungus cell membrane have ergosterol. They go and bind with the ergosterol. They combine. Polyene combine with the ergosterol because they have high affinity for the ergosterol. After combining with ergosterol, okay, they get inserted in the membrane and they orient the ergosterol in such a way that they form a pore. They form a micropore in the membrane. They form multiple small pores. I will show you the diagram. This is how they are altering the cell membrane permeability. They are increasing the permeability and all the cytoplasm will leak out. Once the cytoplasm is leak out, it will cause death of the fungus. You can see this is a fungus. In this fungus, the Amphotericin B will go inside. After go inside, it will not bind with the cell wall. No. It will go inside. It is having affinity for the ergosterol that is present in the cell membrane. It will bind with ergosterol of the cell membrane. Once it will bind with the ergosterol of the cell membrane, it get inserted in the cell membrane all around. Wherever it is inserted, it will cause orientation change of the ergosterol in such a way that it will form a pore there. Small micropores are formed. Since small micropores are formed, all the cytoplasm will leak out and the cell will die, this fungus will die. So mechanism of action is on cell membrane, not on nucleus, not on cell wall. You can see the diagram. Can you see the first diagram? See the first diagram. Let me show you. In the first diagram, you can see this is ergosterol. This is cell membrane. The green color is the ergosterol. Can you see? This is ergosterol. Can you see? This is ergosterol. So Amphotericin B is going. You can see this is Amphotericin B, which is going and binding with the ergosterol. It is having affinity for ergosterol in the cell membrane. Once it go, bind with the ergosterol, get inserted there, it is causing orientation of the ergosterol in such a way that it is producing a pore. It is producing a micropore, a small micropore, a hole. You can say a hole in the cell membrane, a micropore or a hole in the cell membrane, from which the entire cytoplasm will leak out. The entire cytoplasm will leak out from here. Once the entire cytoplasm will leak out, the fungus will die. And this is its mechanism of action. This will cause death of the fungal disorders, or fungus, death of the fungus. And this is how it is acting. You can see it is causing pore formation. That is the mechanism of action of Amphotericin B. You can check it here. I told you the classification. No? This is the classification of antifungal drugs. Where is polyenes are coming? Polyenes are coming in the cell membrane. They are altering cell membrane. You can cross check. Altering the permeability of the cell membrane. Okay. It is fungicidal at high dose, fungostatic at low dose. At low dose, it don't kill the fungus. It just inhibit the fungus from multiplying. But at high dose, it kills the fungus. So it can be fungostatic, it can be fungicidal. Okay. Now, in human membrane, cholesterol is present. Okay, in fungus membrane, ergosterol is present, but both are very closely resemble. Okay, suppose there is a patient. This is my patient body. Okay, my patient is having a fungal disorder. Okay, suppose this is the blood vessel of my patient and it contains fungus. So this is the fungus. This is the cell membrane of the fungus. And this is my human cell, my patient cell. Okay, my patient cell contain cholesterol, but the fungus cell contain ergosterol. Okay, the cell membrane of the fungus is made up of ergosterol, but the cell membrane of the human is made up of cholesterol, and both are closely resemble with each other. Both very closely resemble with each other. Are you getting it? Now I am giving Polyenes as a treatment. Amphotericin B, Polyenes is a treatment via any route, maybe oral, maybe parenteral. So ultimately this drug reaches in the blood. In the blood, it bind with the ergosterol and causes pores here, but it bind with the cholesterol also, because both closely resemble, and causes pores here. That's why it is highly toxic. It causes many side effects in human, and nowadays we don't much use it. Although it is having widest spectrum, it can kill any fungus, but nowadays we are having better drugs available, that is azoles, which are having less toxicity. This one is having more toxicity. This is the reason. The reason is that amphotericin B bind with the ergosterol, very good, but it can bind with the cholesterol of the human cell, which is not good. It will cause many side effects. Okay, so the same thing is written. You can see ergosterol, which is present in the fungus cell membrane, closely resemble with the cholesterol present in the human cell. That's why Polyenes bind with the cholesterol as well, although with a less affinity, but it bind. And that's why it shows toxicity. It is one of the most toxic antifungal drug. Okay, but bacteria don't have cholesterol or ergosterol in their cell membrane. So amphotericin B or Polyenes have no effect on the bacteria. They have effect on the human cell or fungal cell. They don't have effect on the bacteria. Pharmacokinetics you should learn. Amphotericin B is not absorbed orally. It is not absorbed orally. It can be given orally only for intestinal candidiasis. It is not absorbed orally. So oral route is not possible. Only in case of intestinal, where the site of action is the lumen of the intestine, that is intestinal amoebiasis or intestinal candidiasis. In that case, we will give it orally. Otherwise, we don't give it orally. So we give it IV. We give it IV. Most common route, we can give it IV. We can give intrathecal also in case of meningitis, fungal meningitis, direct intrathecal injection. So the second route is intrathecal, or else we give it topically in the eye, in the form of the eye drops. In the form of the eye drops in case of corneal ulcers or keratitis. So we give it IV, we give it intrathecal, we give it topical in the form of eye drops. But we don't give it oral unless and until the patient is having intestinal candidiasis. That is a pharmacokinetics. Coming on the adverse effects. What are the adverse effects here? The adverse effects, the most common adverse effect is infusion-related acute reactions. Okay. We are infusing it, na? Most common route is IV. So infusion, at the site of the infusion, there may be phlebitis, okay, inflammation of the veins, anemia can be there, okay, phlebitis is there, non-specific headache, anorexia, vomiting, fever, chills is there, okay, but don't learn that. Learn the specific one. Learn the specific adverse effect of all drugs. Non-specific you can write by yourself, but the specific adverse effect here is nephrotoxicity. These all are non-specific. These are non-specific. The most common side effect is infusion related. That is phlebitis and all. Okay. But that is non-specific. The specific one is nephrotoxicity. It affects kidney. It is toxic for kidney. Nephrotoxicity. The most common adverse effect is nephrotoxicity. Most important dose limiting toxicity is nephrotoxicity. The risk is more than 80% cases have nephrotoxicity. What are the manifestations? Whenever the kidneys are affected by amphotericin B, patient have azotemia, patient have reduced GFR, patient have acidosis, hypokalemia. Here it is written, na? Hypokalemia is there, okay, and inability to concentrate the urine, okay, but it is reversible. Once the amphotericin B is stopped, it is reversible, okay, but concomitant use of other nephrotoxic drug is contraindicated when amphotericin B is given. When amphotericin B is given, you can't give aminoglycosides, cyclosporin or vancomycin, because they are also nephrotoxic. So if you give them together, two nephrotoxic drugs together, patient have severe nephrotoxicity. So nephrotoxicity is the most important adverse effect. So whenever you start amphotericin B of any patient, you keep on monitoring these at least alternate day or weekly. Okay. So we will keep on monitoring creatinine, serum potassium and serum magnesium, because it is causing hypokalemia. It affects kidney. That's why we have to monitor three things: serum creatinine, potassium and magnesium. We keep on monitoring daily or alternate basis, based on which we will decide whether to continue the therapy or not. These are the parameters to be monitored. How to minimize nephrotoxicity? Ask the patient to take adequate hydration when the patient is on amphotericin B. Because it is nephrotoxic now, patient should drink abundant of water or fluids, number one. And pre and post infusion of the amphotericin B, we should give mannitol. We should give mannitol before the amphotericin and after the amphotericin B, so that it remains in the body for very short duration. And mannitol is a diuretic. It will cause more urine and that will cause excretion of the amphotericin B. Alternate day therapy. Instead of giving daily, we can give alternate day therapy. And the best thing, instead of using plain amphotericin B, you can use liposomal amphotericin B. What is liposomal amphotericin B? You can see. This one is plain amphotericin B. Simple amphotericin B. It is causing highly nephrotoxicity. The most important adverse effect is nephrotoxicity. So instead of giving it plain, combine it with a liposome. You can see it is liposomal. Combine it with a liposome. You can see this one is liposomal. We are combining the amphotericin B with a liposome, it becomes less toxic. It becomes less toxic. So if we are combining the amphotericin B with liposome, it will improve the tolerability of the patient of IV infusion of amphotericin B. Toxicity is reduced. Okay, and we can give more targeted therapy. Okay, targeted delivery is achieved. Okay, and it is equally efficacious. It is equally efficacious. Clinical efficacy is same. Renal toxicity is minimum, but it is costlier. The only thing, it is costlier. It is costlier. If the patient can afford, we can go with the liposomal amphotericin B. The advantage is it produces milder IV reaction. It produces less nephrotoxicity. It produces less anemia. All the side effects are less. All the side effects are less. What are the uses of amphotericin B? Although it's a broad spectrum, it is having widest spectrum. It can kill any fungus. It is gold standard therapy among all antifungal drugs. It is effective against all systemic mycoses, but we don't use it much because of nephrotoxicity. And we are having better drugs available nowadays, Azoles, which are not having much side effects. So we prefer Azoles, but in some cases we can use amphotericin B. So amphotericin B is drug of choice in these conditions. You know this classification. In this classification, where is systemic mycosis? So amphotericin B is drug of choice for systemic mycosis. That is histo, blasto, coccidio, paracoccidio. Histo, blasto, coccidio, paracoccidio. For these four, amphotericin B is the drug of choice. You can see amphotericin B is drug of choice for these four. Among the opportunistic, I told you these are also systemic now. The only thing, they enter only in immunocompromised person. So among the immunocompromised people or among the opportunistic mycoses, we take 4 out of 6. So you can see we will take aspergillosis, candida, mucormycosis and cryptococcus. So candida, mucormycosis, aspergillus and cryptococcus. So total 8 drugs for which drug of choice is amphotericin B. Please learn, it is not given for superficial or subcutaneous mycosis. No, amphotericin B is given for systemic and opportunistic mycosis. Systemic में histo, blasto, coccidio, paracoccidio, and opportunistic में candida, cryptococcus, okay, aspergillus, and zygomycosis is mucormycosis. So you learn these 4, If you want, you can make a mnemonic for that. If you want. Otherwise, you can learn 4 of them are systemic and 4 of them are opportunistic. So 4 plus 4, total 8. For these 8 infections, amphotericin B is drug of choice. Either drug of choice or second drug of choice. Or rather, you can see this table. Nowadays, I told you, now we prefer Azoles because amphotericin B is having much side effects. Okay, it is having higher toxicity. Most important toxicity is nephrotoxicity. That's why we prefer Azoles. Okay, so you can see here for histo, coccidio, blasto, paracoccidio. You can see we are using either Azole. Azole is itraconazole, Azole or amphotericin B. You can see amphotericin B or fluconazole, itraconazole or amphotericin B. So we are using either Azole or amphotericin B. Okay, and in others also you can see in aspergillosis, mucormycosis, in candidiosis, amphotericin B is drug of choice, but we can use Azole also. Okay, so it's the choice of the physician who want to give Azole to his or her patient or want to give amphotericin B to his or her patient. Okay, so amphotericin B is done, but we are having Nystatin and Hamycin also. These 2 drugs are also there in the Polyenes now. Amphotericin B is done. Nystatin is obtained from Streptomyces norsei. You have to learn this name of organism, but it is applied only locally, topically. It is not given orally. It is available in the form of the ointment. It is available in the form of the ointment, and it is given in superficial mycosis. It is given in superficial candidiasis, not superficial mycosis. It is given in superficial candidiasis. That's it. Hamycin is obtained from Streptomyces pimprina. Okay, it is similar to Nystatin and only topical application. Only topical application. So we are done with Polyenes. So out of, you can see the 6 categories, the first is done. Can we revise it quickly? Polyenes. So we can come on the second category. Can we revise Polyenes quickly? Give me a minute. I'm sorry. Let's revise polyenes quickly. So in the introduction, you should write down why polyene is known as polyene, because it is having multiple double bonds. That's why it is known as polyene. What are the drugs in this category? The drugs is Amphotericin B. The drug is Nystatin and Hamycin. Nystatin and Hamycin. These are the drugs in this category. What is the mechanism of action? The mechanism of action, it is having affinity for ergosterol of the cell membrane. So amphotericin B go bind with the ergosterol of the cell membrane and get inserted in the cell membrane, and it causes orientation of the ergosterol in such a way that it leads to formation of micropore, and from this micropore all the cell constituents cytoplasm will leak out and the fungus will die. Pharmacokinetics, it's not given orally. In case of intestinal candidiasis, it's given orally, otherwise it's not given. It is given IV or it is given intrathecal. Okay, or it is given in the form of eye drops topical, but it is not given oral. Orally it's not given. So IV, intrathecal or topical routes are there. Interactions, there is nothing important interactions we are having here. Adverse effects, there are many adverse effects, but they are non-specific. The most specific adverse effect is nephrotoxicity. Nephrotoxicity, you should explain why. Because the amphotericin B bind with the cholesterol also of the human, cholesterol of the cell membrane of the human. Okay, nephrotoxicity, and that's the most severe adverse effect. We can minimize it by taking adequate hydration in the patient. Okay, alternative therapy, or we can give mannitol infusion before and after amphotericin B infusion, and most importantly we can use liposomal amphotericin B instead of plain amphotericin B. That is causing minimum side effects. Okay, users may, you can write down 4 systemic mycoses and 4 opportunistic mycoses. What 4 systemic mycoses? Histo, blasto, coccidio and paracoccidio. Opportunistic में candidiasis, mucormycosis, cryptococcus and aspergillus. So total 8 disorders में it's drug of choice. But nowadays we prefer azoles. That's also you should write. So coming on the next drug, that is Echinocandins. So we are done with polyenes and now we are coming on Echinocandins. Let's start Echinocandins. Okay, Echinocandins have cyclic lipopeptide structure. They don't have multiple double bonds in their structure. They are cyclic in nature and they are lipopeptides. They have low toxicity as compared to amphotericin B. That is the introduction. Drugs, we have fungin, Caspofungin, Mica fungin and Anidula fungin. Fungin. So the suffix here is fungin. Caspofungin, Mica fungin and Anidula fungin. You can see. So here also we were having 3 drugs. Amphotericin B, Nystatin and Hamycin. Here also we have 3 drugs. Caspofungin, okay, Mica fungin and Anidula fungin. All of them are fungins. So learn the name of the drug. Learn the name of the drugs in this category. Learn the name of the drugs in this category. So these are these are Echinocandins. Okay, most important among them is Caspofungin, the prototype. There, the prototype was Amphotericin B. Okay, in polyenes, the prototype was Amphotericin B. Here, the prototype drug is Caspofungin in Echinocandins. So we will discuss the prototype drug. Okay, among the non-prototype drugs, I will tell you 2-3 lines. But mainly, we will discuss the prototype drug. So Caspofungin is the main drug here. What is the mechanism of action? You only tell me. What is the mechanism of action? Amphotericin B was acting on the cell membrane. Caspofungin act on the cell wall, not on the cell membrane. Can you see this fungus? Okay, can you see the cell wall of this fungus? The cell wall of this fungus made up of 2 things. There is chitin, okay, and there is beta-1,3-glucan. Beta-1,3-glucan. These 2 things bind with each other and make the cell wall, not the cell membrane. Cell membrane contain ergosterol. Okay, cell membrane is made up of ergosterol. That's a separate issue. But currently I'm talking about cell wall. So if I give Caspofungin to my patient, if I give Caspofungin to my patient, this Caspofungin will go in the cell wall, this Caspofungin, and it inhibit beta-1,3-glucan synthesis. Beta-1,3-glucan synthesis. If beta-1,3-glucan is not formed, the cell wall will become weaker. Okay, because cell wall is formed by cross-linking between beta-1,3-glucan and the chitin. and a chitin. If beta-1,3-glucan is absent, how chitin will bind with beta-1,3-glucan? Beta-1,3-glucan is not formed, so cell wall become weaker, and that will lead to osmotic susceptibility of the cell wall. The fungus will lose the cell wall, fungus will swell and die. Okay, fungus will soon lose the cell wall. I mean, cell wall synthesis is inhibited, and the fungus will swell and the fungus will die. So this is the mechanism of action, inhibition of cell wall synthesis by inhibiting the synthesis of beta-1,3-glucan. So amphotericin B was binding with the cell membrane ergosterol and producing the pores in the cell membrane so that the cytoplasm leak out. Okay, Caspofungin or Echinocandins inhibiting the synthesis of beta-1,3-glucan in the cell wall so that cell wall is not formed. The fungus loses the cell wall. It will swell, burst and die. So you can see this diagram. In this diagram, you can see this is cell membrane. This is cell wall. So amphotericin B is producing pores in the cell membrane by binding with ergosterol. And Caspofungin or Echinocandins act on the cell wall and inhibit the beta-1,3-glucan in the cell wall. So cell wall is not formed. It become weaker. I hope you all got it. Okay. So here also you can check amphotericin B was coming in the cell membrane. Okay. And Caspofungin is coming in the cell wall. Okay. So it is inhibiting the cell wall synthesis. It is given only IV. It is not given orally, not intrathecal, not topical. Only IV infusion. It is not given orally. Only IV infusion. Okay. Adverse effect. Non-specific adverse effect are there. That is vomiting, dyspnea. You don't have to learn. You have to learn the specific one. The specific one is phlebitis. Okay. It is causing phlebitis like amphotericin B. It is producing joint pain. Joint pain is something unique. And hypokalemia, here also we have hypokalemia because it is little bit nephrotoxic but not much as compared to amphotericin B. So joint pain and hypokalemia are the main adverse effect. Uses में aspergillus and candidiasis. Mark it here. You can see where is candidiasis and where is aspergillosis. Candidiasis में two type of candidiasis. Invasive candidiasis and esophageal candidiasis. So it is esophageal candidiasis and it is invasive candidiasis and aspergillosis. It is not for histoblasto, coccidio, paracoccidio and others. No. In contrast to amphotericin B. Amphotericin B was first line drug in the eight fungal disorders. 4 systemic and 4 opportunistic. This one is drug of choice only in 2. Candidiasis, esophageal candidiasis, invasive candidiasis and aspergillosis. This is how you have to learn. Okay. There's a new antifungal drug. The name of that drug is nicomycin. What does nicomycin do? What was Caspofungin was doing? Echinocandins. Echinocandin or Caspofungin inhibit beta-1,3-glucan so that cell wall do not form. Okay. This drug, nicomycin, inhibit chitin. It do not inhibit beta-1,3-glucan, but it inhibits chitin. So either one of them is absent. Either beta-glucan is absent or chitin is absent. Ultimately, cell wall will not form. Okay, so if we give Caspofungin, beta-1,3-glucan will not form and that's why cell wall will not form. If we give nicomycin, chitin will not form and that's why cell wall is not formed. So it's a newer drug. You can learn its name. It is nicomycin. It also inhibits cell wall synthesis like echinocandins, like Caspofungin, but the mechanism is different. It do not inhibit the formation of beta-1,3-glucan. It inhibits the formation of chitin. So you get this MCQ, nicomycin. Please learn that. Okay, so we are done with echinocandins. Can we revise them together? 2 of them are done. Quick, fast people. 2 of them are done. Introduction, here you write down why they are known as polyenes because they are having multiple double bonds in them. Okay, echinocandins, they have a cyclic structure. Okay, cyclic lipopeptide structure. They are less toxic. Drugs, tell me the drugs in each category. Tell me 3 drugs here. Tell me 3 drugs here. Can you tell me the name of the drugs, please? Yes. The name of the drugs here is amphotericin B. The main prototype drug here is amphotericin B. But we are having Nystatin and Hamycin. Here the main drug is Caspofungin. But we are having other fungins also. What were the other fungins? Mica fungin and one more fungin. So all those fungins are there. Fungins. Here the prototype is amphotericin B. Here the prototype is Caspofungin. Okay, mechanism of action. The mechanism of action, it acts on the cell membrane of the fungus. It acts on the cell wall of the fungus. This one, amphotericin B, go bind with the ergosterol of the cell membrane and produce pores in the cell membrane so that cytoplasm leaks out, fungus die. Okay, this one, Caspofungin, go in the cell wall and inhibit beta-1,3-glucan formation in the cell wall. Since beta-1,3-glucan formation is not taking place, chitin will not do the cross-linking and that's why it causes weakening of the cell wall and the fungus will die. Okay, so this is how they are acting. One on the cell membrane, one on the cell wall. You have to write down the exact steps. Okay, coming on the pharmacokinetics of both of them. Pharmacokinetics, easy. Pharmacokinetics, this one given orally only in case of intestinal candidiasis, otherwise IV, intrathecal or topical eye drops. This one given only IV. That is pharmacokinetics. Interaction, we don't have any important interaction. Adverse effect. Here the specific adverse effect is nephrotoxicity. Here the specific adverse effect is joint pain and hypokalemia. Hypokalemia. These are the specific. Non-specific you write by yourself. Phlebitis occurs in both. Here also phlebitis. Okay. Uses. The most important is uses, people. So here we have 4 plus 4, 8 uses. And here we have only 2 uses. Say. Here, what are the 4 systemic mycoses? Histo, blasto, coccidio, paracoccidio. And what 4 opportunistic? It's candidiasis, aspergillosis, cryptococcus, and mucormycosis. This one, candy and aspergillus. That's it. Candidiasis and aspergillosis. Candidiasis may esophageal as well as stomach. So that's it. Okay, so this is how you have to learn. Okay, so you know the uses, you know the specific adverse effect, you know the pharmacokinetics, routes. Most importantly, you know the mechanism of action, you know the name of the drugs, like that. Coming on the third category, so antibiotics will be done.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So, join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.